Doctor, what are the other health and disease trends that you see amongst kids today? Allergies, asthma, autism, Down syndrome, obesity-related disorders? Tell us more.
Well, all these are pretty common even in Indian setting. Previously, there was a belief that developing countries like India, we have poor kids in overcrowded environment and infection is the only issue with us. No, today if you look at the spectrum of illnesses that we see pediatricians, apart from these infections, we do come across this allergies and asthma and autism and, as I said, problems with overweight and obesity. There are a lot of reasons why this thing is on rise. You have a lot of industrialization, pollution. All of us have heard about global warming, and all these allergens and pollutants are adding to the burden of asthma. Today we have many children who wheeze, who sneeze, so allergic rhinitis, asthma, asthmatic bronchitis, all these conditions are on the rise. Autism is also now, I really wonder if there is a really increase in autism. What probably I feel is the awareness has gone up and we are diagnosing more and more autism, and maybe it is associated with some increase in the incidence also. But yes, certainly we do see these diseases. So as I said, gone are the days where only developing countries are only infection as major problem. We have these non-infectious conditions also becoming important even in developing countries. Yeah. If you talk about the trends, see, like in the past we had smallpox, which is no longer there. We used to get a lot of cases of measles. Today luckily our immunization coverage is good, and the measles infection in general, especially in well-to-do class, is almost disappeared. We had many cases with diarrheal disease getting admitted. Well, that has not totally disappeared. Pneumonia and diarrhea continue to kill many children under the age of 5 years globally, and more so in developing countries like India. But that is more of a problem of rural India. In urban population, yes, these common infections and illnesses are going down. But then all this niche that is created by less of this infectious illness is taken by non-infectious diseases like allergy and asthma and autism and Down syndrome. You have illnesses like, say, Kawasaki disease or not rheumatic fever. Rheumatic fever in general again is going down, but non-infectious, say, rheumatoid arthritis and other rheumatic disorders are coming in. They are being recognized, and so on and so forth. There are several others, but in general there is less infection seen amongst well-to-do, well-nourished children, and more of non-infectious illnesses which are started coming in. Then there are certain infectious illnesses which were seen way back in the very old age. These infections have re-emerged, like, say, dengue, chikungunya, and say leptospirosis. These infections have started again now surfacing, and we have rickettsial fever. These infections are now being seen more and more all over the country.
Well, thank you, Doctor. This was very insightful, and it was a pleasure having you.
Thank you, sir.
Thank you.
Thank you.